Hi, my name's Adrian and I'm the principal dentist at Advanced Dental Artistry in West Perth.
My name is Marina and I work as a client services manager in a digital marketing agency. I've started realizing that I wasn't totally happy with my teeth when I started watching my YouTube videos, and there was like those little things that were making me uncomfortable. I didn't want to change my smile completely. I just wanted an upgrade, so I started searching on Google things like cosmetic dentists, and then I found a lot of websites that show teeth that weren't like natural at all. They looked very Hollywoody kind of style. I'm like, that's not what I want. And then I found Dr. Adrian's website, and then I was amazed by it. Everyone looks so natural and amazing at the same time, and that's exactly what I was looking for.
When we first saw Marina's case, I think a lot of the patients that actually come in today especially are really looking for natural cosmetics, and they want cosmetics that really people don't notice. You don't want to get a smile done or get something done where people will say, I think you've had your teeth worked on. So the idea really is to actually incorporate the most natural aesthetics and the most natural cosmetics that we can do. So the diagnosis really was one, to listen to what, I suppose with all patients that actually come through, is just listen to what patients actually want, to really understand where they're coming from and what their needs actually are, and listen to their concerns very carefully. I think the biggest thing with cases is that a lot of patients have been thinking about getting cosmetic treatment for a long time, and they really are unsure of what the end result's going to look like. So there's a lot of planning that needs to go in place, and what we really need to do is actually to show exactly what's going to happen before they get treatment done. So there's a number of ways that we do that. Of course, on computer systems we can actually plan that, but I think one of the most important things to do is actually to show the patient a preview before the final porcelain is done, and we call this a trial smile, where what we do is we actually will place a trial smile in a patient so that they can actually really go home, they can take photos, they can really see what that final smile is going to look like. And until we get their final sign off that everything is perfect, we will not actually make porcelain until we actually get that okay. So with all cases, the idea really is to make sure that the patients get to test run their smile first. They get to actually confirm that everything is fine before the final porcelain is actually made.
I couldn't believe it because it was still me, but an improved version. I found it perfect, but at the same time so natural, so it was beyond what I was expecting, and it changed my life because obviously I'm smiling more. I think the end result of that is you get more sociable. My work is to make people happy, so I deal with clients, so I'm smiling more, and everyone noticed that I'm being more positive about life as well because I'm smiling more.
I think with a lot of clients that are actually coming into the practice nowadays is they're really looking for the most natural aesthetics possible. So the idea is to not walk away with Hollywood teeth or teeth that are really, really white, or really cosmetics that is very noticeable, because one of the things is when patients actually come in, they don't want to actually go out and say, oh, to friends and family, you've had your teeth done. So I think nowadays with where technology is actually heading is we're able to now clone teeth and the look of teeth, and teeth have a very unusual DNA. The surface texture of the teeth and the characterization of the teeth is actually really important in making a tooth look like a real tooth. With current technologies and the scanning process and digital cloning, is we're able to actually copy the natural aesthetics of the tooth, and that includes the natural surface texture and shape of the tooth, but also to do with the translucency and the color of the tooth. And all that goes through to really ensuring that at the end, the smile is as natural as we can possibly make it.
I would definitely recommend it for everyone who wants a new smile, and I have a lot of friends that are already asking what I've done mine.